Hi everybody, welcome to North Range Eye Care. Today we're going to take you through one piece of our technology. It's called our Edger and Finisher. We're going to actually make for you a full pair of glasses today. So, to start, we've picked our frame. Our patients picked this beautiful BCGB frame, which is very cute. First thing we're going to do is we actually are going to pop out the demo lenses, the lenses that come with the glasses that have no power in them. Next, we're going to come in here, we're going to trace the frame. The computer actually will take a 3D tracing of the frame shape. Come on over here and let's show them what it looks like when we trace it. So I'm going to hit trace. So as you can see, it's going to trace both sides, and it does it in 3 dimensions to cut the lens perfectly to the shape of the frame. Does both eyes separately. And it creates a digital computer image which we will then transfer to the edger, which will cut that shape of the lens into the frame. Okay, so now that our frame is now set in there, the next step is we're actually going to get the lenses ready to put into the machine. So, when we order a pair of lenses for somebody, it comes as a blank. As you can see, it's definitely very big, definitely too big to go in there, so we need to cut it down to size. Now, what we do is we've actually marked the optical center of the lens, because if a lens has astigmatism, like this one does, it can be rotated at any of 180 degrees, so we need to set it correctly. To do that, we have here our, what we call our blocker. Come on closer so you can see. So, I use the blocker to set the lens so the astigmatism is at the right angle. I come over here, I put this blocker, it might help if I put that on first. So first we have this little unit we're going to use. Stick it on there. Alright, let's do that again. So, make sure the astigmatism is set correctly on that. Bring it over, punch it down, take it off, make sure it's nice and tight on there, and now we're ready to cut that lens in just a second. So, the next step is we're going to use our edger. This is what actually cuts the lenses down to size. So inside here we have different things. We have the clamp that holds the lens in place, little faucets that bring water, and then what we call the edger itself, which will actually grind down the size of the lens. Down below, we actually have a filtration system that recycles the water over and over again. 2 separate engines or motors that do that for us. So, to do our first lens, we've brought the frame data over. We have to set the distance between the patient's eyes, set what kind of lens we're cutting, what kind of frame we're doing. That's all set. We're going to put this in. Going to clamp that down. Sorry, tough to see. So now we're ready to go, and we're going to double check everything so we don't have to redo it. Everything's plastic, good. Alright, so we're going to go ahead and hit start. Oh, gotta use a smaller one. Okay. Also like over the top. So first the machine will measure the lens to make sure that there is enough size for the frame we're going to use. We'll measure the other side, make sure the curvature of the lens is correct for the frame we're using. So it's actually tracing out that 3D image we found before to make sure it'll fit. Now the motor will start up. Alright, so that lens is complete. We're going to take it out. We're going to make sure that it's the same size as the one we started with. Looks like it's pretty good there. So, when that comes out of the edger, the edges are actually very sharp. You can actually slice your finger if you're not careful, which I've done plenty of times. So we're going to use it, put a little safety bevel on it, kind of take the edge off. There we go. Dry it off here. Before I take that thing off, I'm going to make sure that it fits. How about if I put it in the right side? This is when you have to get rough with the frame. There we go. Good. So that fits. Take that off. Now we haven't done the other side yet. We'll do that in a second. But I think this will be good for now. So as you can see, that frame is fitting just perfectly with that lens we just made. And now it's ready to deliver to the patient once we make sure everything's set up. So, this is something that we offer at North Range Eye Care that not all practices do. Insurance companies, they like to cut their own, but if you're paying for your glasses by yourself, we can turn around the frames and glasses a lot quicker. If you ever need a lens replaced, we're also able to do that while you wait. Thank you for joining us, and hope to see you here soon.